And thanks for joining us on this Monday as we begin a new week and consider the challenges that lie ahead of us. Welcome to our members of the media and those who are joining us broadcast and online today. Orange County Mayor Demings will discuss our positive cases, goals for the week, new testing locations, CARES Act funding, and more. Orlando Mayor Buddy Dyer will talk about the importance of wearing masks, also testing sites in the city, and the 4th of July as it relates to the city of Orlando. Dr. Alpino from the Florida Department of Health here in Orange County has information on our testing numbers, time frames, hospitalizations, and other important data. We begin with Mayor Demings. Mayor.
All right, thank you, Dr. Williamson, and thank you to all of you for once again coming. I hope you had a good weekend this past weekend, and this week going forward. We got a lot going on here within Orange County as we approach Independence Day. Each Monday I come before you and I like to really just outline my goals for the week. This week, of course, we continue to have the number one goal is to slow the spread of the virus within our community and continue testing. You will see us endeavor to increase testing throughout the county. Number two is to continue to work with the Department of Health to increase the contact tracing. You are going to hear from our health officer, Dr. Pino, in just a moment, who will talk about some of the efforts to do that. Number three is to increase the number of people wearing masks within our community. I have to say that given some of my observations over the weekend, I traveled around quite a bit just observing and I have to applaud our residents here within Orange County. After we put the mandatory order in place, it does appear that we have seen increased willingness to wear masks within our community. That should translate, I believe, into a slowing of the spread of the virus in our community, and we've now been under that mandate for a little over a week, and you're going to hear some of the numbers that are going to be presented today, and you'll be the judge of whether or not it may be helping to slow the spread of the virus. The fourth thing that we look to do this week is to continue providing CARES Act crisis assistance to our Orange County families and businesses. And so I'll give you a little bit of an update. Here within Orange County, we broke the 10,000 mark in terms of the number of positive cases of coronavirus within our community. We had no idea that we would reach this point, certainly not as quickly as we have within the month of June itself. A total of 10,014 COVID cases were reported this morning, and that was an increase of about 343 cases over the day before. We continue to maintain the 56 deaths unless there's something that happened within the last few hours. The 343 cases, while it is a triple-digit increase, there's a bit of good news here in that we had seen day-over-day increases of 900 and 1,000 plus for the last several days of this past week. So when we saw 343, that's the lowest number, at least in a week or so. But we can't just sit on our laurels because we are approaching this 4th of July weekend, and most of the large gatherings have been canceled or postponed, but there still will be some that will occur. And it will be critically important for members of our community to adhere to the directives that we put in place. We have now tested over 134,000 individuals, and our positivity rate is now at 7.5%. And just think, just a couple of weeks ago, we were at 2.8% here within Orange County. We're now at 7.5%. Our 7-day positivity average has been 12.7%, which is down slightly from the 14-day average of over 15%. Yesterday, according to the records that we received, there were 1,763 people tested at the state-run regional COVID-19 testing site, which is at our Orange County Convention Center. This was the highest number of tests given compared to the other regional testing sites throughout Florida. Orange County, the Orange County Convention Center led the state in numbers. The Convention Center site has a goal to test 2,000 people per day. the lines can be a little long there. Orange County Health Services continues to do free testing at Legacy Middle School this week. I will warn you that it is better to make appointments, and the appointments at Legacy Middle School for this week have been completely booked. However, they will test others, but you will have to wait in line for an undetermined period of time if you go there for the testing. We will be testing again next week at the Legacy Middle School, Monday through Thursday, which is July 8th through the 11th. We will be doing testing at that location. And in terms of CARES Act funding, Orange County residents who have applied through our online portals for family and individual assistance now number some 8,900. So just under 9,000 different individuals and families have applied and been approved at this point. You know, checks are still being prepared, but that represents about $8.9 million in assistance. For Orange Cares for small businesses, we have an uptick in applications since we expanded the criteria. And of course, the small business assistance is for the $10,000 grants. It includes businesses with fewer than 100 employees now and businesses that have not received the PPP federal loans up to $50,000 can apply for the $10,000 grants here within Orange County. So far, the Orange Cares for Business has allocated nearly $13 million have been submitted for processing through the Comptroller's office. And let me just talk a little bit about some of the positive cases that we're seeing here within Orange County. We've had several of our animal services staff who have tested positive for the virus, and out of an abundance of caution and concern for the health and safety of our staff, volunteers and visitors, Animal Services is temporarily closing to the public until at least tomorrow. We are doing an evaluation of staff in the facility at this time, but the building has already been sanitized, and staff who had prolonged contact with these individuals are quarantining for the next 14-day period of time. We're also working with the Florida Department of Health in Orange County on contact tracing, and Dr. Pino will talk about that in just a few moments. This past weekend, in terms of good news, 250 pet owners received free dog food and cat food and other animal food when we did large-scale distribution at Barnett Park. We will keep you posted. We'll do that again in the very near future, and so stay tuned for that. And with that, I'm going to turn it over to Mayor Dyer, and then Dr. Pino will come after that.
Thank you, Mayor Demings. As the numbers continue to climb, this continues to show us it's not time for any of us to be complacent. It's our time to take care of our community. In Orlando, we're a strong and resilient city, and time and time again, we've come together to take care of each other. It's more important than ever that we channel that same spirit now through our collective actions. I can't stress the need to continue to wear a mask wherever you go, indoors, and whenever you can't socially distance. These simple face coverings are probably our most critical tool right now in terms of battling the virus. And it's not about politics. It's about the health and safety of our community. Testing also continues to be critical. We remain committed to testing in the city and are expanding our efforts to add new sites to the end of July. We'll be at the Smith Center on Wednesday, July 1st from 10 to 2. We'll be at Camping World Stadium on Wednesday, July 8th from 9 to 1. Appointments are available for both of those at orlando.gov. With 4th of July coming up, I want to remind everybody how critical it is to celebrate safely with your loved ones. We don't want to repeat of Memorial Day weekend where we think a large part of the new cases might have come from. So if you're making your plans, make sure that the health and well-being of everybody remains at the forefront. And it is not safe to celebrate as we have done it years in the past with 100 to 120,000 people surrounding Lake Eola. So our annual fireworks this year are going to be virtual. On Channel 6 on Saturday night with a salute to heroes in our community and a pre-recorded combination of the brightest and biggest fireworks from the past several years. I know it won't be the same, but it will allow us to keep working to reduce the spread of the virus. Dr. Pino.
Thank you, Mayor. Good afternoon. As the Mayor informed, we reached the 10,000 mark, which we were not expecting it to be this fast or ever getting to this number for that matter. We have received today, the data for today, and these are yesterday's results, 2,248 cases negative, and 345 positive cases. That's a 13.3% positivity rate. Just to give you an idea, last time that we had 13 was on June 22nd. June 22nd was the last time that we had 13. And although we don't want to be complacent about it or give you false hope, it could be that the data is starting to indicate a little bit of the results of mandating the mask. But tomorrow will be a day that will tell a little bit more about that. We have an additional death, 57, but we don't have the results and the information yet, so it's not posted there. And for the 4th of July, that is coming, and both mayors have talked about it. Wear your mask, wash your hands, wash your distance. If we follow these 3 W's, we will all be fine. We are in phase 2, and also remember that phase 2 doesn't allow any gatherings more than 50 people at this time. Also, I would like to mention, before I move into a little bit deeper on the data, that we would like to increase our immunization rates for our children going to school. We continue to offer vaccination for free for kids going into grade 7th. And soon, in the summer, we will be offering vaccination for all ages at the West Oak Mall like we did last year. It is important to call 407-723-5004 if you want your child who may be going in 7th grade to be vaccinated before our summer event. The positive thing about vaccinating a kid for 7th grade is most of them only need 1 vaccination. So that's done quickly, and the kid will be able to get into school when the school years restart. We also would like to say that the median age in the last 14 days is 30 years old for our county, which is younger than the state. And also 1,000 cases per 100,000. Remember, we have mentioned these as the 26th. We had 329 cases per every 100,000 individual in our county. That's the calculation. Our increase last week was about 160% over the prior week. To give you the figures, for example, in week 24, we have 858 cases. That was an increase of 201% from the previous week. This is when we start going wild. On week 25, we have 1,751 cases for a 104% increase. And in week 26, that's last week, we have 4,545 cases in 1 week, and that was an increase of 160%. Another important data is that the median age for the people who are dying in our country has decreased by 1.5 years. So that it goes with what we have mentioned before, is that the cases that we have seen are younger and younger, and of course it has been a reflection on the median age for the death rate. Our median age, as I mentioned, is 30. For the entire state is 34. And also, I know the media has been interested in the hospitalization data. So we have, as of today in the morning, 27 individuals in ICU for COVID-19. We had 156 in non-ICU for 193 total people hospitalized with an ICU COVID-19 diagnosed in a hospital. I will answer any question that you may have, Mayor.
Okay, we'll take any questions. If we have any Spanish-speaking media that's present that would like to ask questions in Spanish, feel free to do so at any point during the press conference this afternoon, and we'll have either Dr. Pino respond if the questions are for him, or I'll have Ms. Ilia Torres come forward and interpret for me. Okay, questions? Well, we got the mic here, and he's moving around with the microphone.
Yeah. Perfect. Hey, Eric Mock here, Spectrum News 13. So you both mentioned, well, everyone mentioned about July 4th weekend and how large gatherings are canceled, but we've seen other areas, closing down certain areas, stuff like that. Are you going to take any other measures to make sure people are, not gathering in large groups on July 4th, in areas around the county or the city? And this question is for both of you.
I think we have already been proactive in that regard, and where those large outdoor public assembly events would have taken place and required any type of governmental permitting, we're not permitting them when in the unincorporated area. And I'll let Mayor Dyer speak about the city of Orlando, but essentially we all across the region have canceled any of those large gatherings. That doesn't mean that there won't be something spontaneous that may occur. I know that several of our theme parks, internal to the theme parks, they're going to continue doing their Independence Day fireworks, but that usually is small groups of people that will be on property inside the parks actually viewing or participating in that. There'll be ample opportunity to social distance and to wear a mask, et cetera, to do it safely is what I'm saying inside those locations. So, Mayor Dyer.
Same thing for us. We haven't issued any 18A permits, which is permits for large gatherings, and we haven't rented out our parks to any groups, and we're adhering to the Phase 2 rules of the governor, which is gatherings of less than 50. So we encourage people to continue to adhere to all the CDC rules and wear your mask and celebrate safely, and we're certainly not bringing 100,000 people to Lake Eola Park to celebrate. That turned out to be a pretty prudent decision.
Hi, Eric Sandoval with News 6. I think this is probably a question for all of you again. You go back to Memorial Day weekend, and I want to say at the time we heard the same warnings. How hopeful are you that people are going to listen this time and stay away from these large gatherings?
Oh, what we have now is the experience of having these thousands of additional new cases within Orange County alone, not just talking about across the entire region. So people have been sensitized now. I think it took spreading the virus where it has now marched down just about every street in the county, and there's somebody that's been infected. It has marched into additional households, into additional workplaces, and so I think because of that experience now has made this more of a believable event and not just one that some thought was contrived for political reasons or what have you. So I believe that our community has been sensitized to it now at this point.
I agree with that, and I like the mayor also were at a couple of places over the weekend, and 100% of the people that I saw were wearing masks, and I don't think that would have been the case over Memorial Day weekend. There were, it was probably a 50-50 chance on whether somebody was wearing a mask, so I think people are adhering to the social distancing and wearing masks.
Okay.
Par de preguntas en español, a couple of questions in Spanish for Telemundo. La primera, the first one, Mayor sort of touched on that previously, which is special measures medidas especiales durante este fin de semana, 4 de julio. Se esperan muchos visitantes. A lot of visitors are expected during this weekend. Este fin de semana va a haber mucha gente de afuera también. Y algunas de las medidas especiales que toma el gobierno de Orange County. Y la segunda pregunta, the second question, is related to possible dates, posibles fechas of reopening applications for the CARES Act funding program, posibles fechas de reapertura para el programa CARES para residentes y para negocios.
You good?
Okay, we will likely reopen the portals for individual and family assistance around July the 13th.
Se espera que podamos reabrir el portal de asistencia para individuos el 13 de julio.
For business crisis assistance, the online portals have remained open continuously.
Para la asistencia para negocios, el portal ha permanecido abierto desde su inicio.
If we see where we have the ability to process the individual and family assistance faster, we may open it before then, but at this point, that looks like the date that we're likely open it again for another 10,000 or so people to apply.
Si establecemos que tenemos la capacidad de procesar con mayor prontitud o rapidez, anunciaremos una fecha. De lo contrario, estamos proyectando el 13 de julio. Mayor, there was a question about any special measures that the county government is looking at taking because of the upcoming holiday and increased visitors and so forth.
So again, I know that Ms. Torres will interpret in Spanish, but we've been proactive and working really across the county and across the region from a governmental permitted perspective to cancel any large gatherings that require government permits.
Hemos sido muy proactivos y estamos trabajando desde el condado y a través de los gobiernos de la región en la cancelación de permisos que involucran agrupaciones o congregaciones de grupos.
Secondly, you're aware that there's a statewide executive order from the governor that essentially has closed bars for this period of time.
Segundo, queremos resaltar que hay una orden ejecutiva del gobernador del estado donde cerró las barras y ciertamente eso ayudaría.
At least they're closed for consumption on premises. They're able to do some other sales, for bottled wine, etc.
Ciertamente las barras, como mencionamos, están cerradas para consumo en las localidades, pero pueden incluir ventas para llevar y entre otras cosas.
And so what we ask the public to do is if they're going to go to family gatherings.
En sus máscaras sigan las directrices del CDC y que se protejan.
Okay. Dr. Pino, did you have anything you wanted to add in that regard?
No, I think that you have, everything that we have done in the last couple of weeks is also getting prepared for this next holiday based on the experience that we have with the prior holiday. So the mask wearing, the bars, and the restrictions that have been placed in some type of establishment and gathering is part of the measures that we are expecting to have some impact. But nothing will make a major impact than our community getting into this issue and taking seriously, as unnecessarily demonstrated the last couple of weeks. If we let our guards down, this will crawl up again. And I think that if we continue to work together, we will see a decline in the number of cases in the coming weeks.
And Dr. Pino, you wanted to respond in Spanish?
Oh, en español. La pregunta es, ¿están los números mostrando algo? Es muy temprano para decirlo, pero es interesante de que hubo un decrecimiento de los números en el día casi 7 de la acción que el alcalde tomó con respecto a las máscaras. Y esta pandemia funciona como un reloj, cada 7 días. Es increíble de la manera que funciona esto. He also asked me if the numbers are showing any signs of improvement. And I said it's a little bit too early to say, but coincidentally today, or yesterday, but today data has the lowest in the last week. And this pandemic works like a clock. It's every 7 days. You can really track everything every 7 days. Every 14 days is the cycle. It is right there like a clock. And coincidentally, about a week ago was when the mask order was put in place. And right after that, the bars were closed. So we could see a decrease in the number of cases, but more is also at the speed of which we are gaining new cases and what that percentage is from week to week. But also we have to watch for the age. If the age starts to increase, then we have made some improvement with regard to the bars and the population that is getting affected. So we are watching.
Dr. Pino, I have a few questions that were texted in for you if you'd like to stay up there. This first one comes from Nassim Miller from the Orlando Sentinel. How are the death numbers and rates compared to the beginning of the pandemic? And if different, why is that?
So this is empirically speaking because I will have to analyze the data at this point and the point that she's mentioning a couple of weeks ago or at the beginning. So one of the trends that we have seen is that some of the people who have died recently are a little bit younger than the prior instance that we have at the beginning of the pandemic, that it was always in the 80s, 90s, 70s. Now we have seen 40s, 50s, 60s. So that's an interesting dynamic. The other dynamic is that many of the people who have died, we know specifically that they are acquired from someone who was diagnosed. So we know who was the person who transmitted to them. And that means a close contact in a limited environment. And that's why we have insisted in protecting people in multi-generational living arrangements, where we have older people living with younger members in the family. And another trend is that we have seen an increase of the number of asymptomatic cases in long-term care facilities.
This next one's from Lauren Seabrook with WFTV. Dr. Pino, we haven't heard any talk about the impact of the protests on the rise in cases. Are people being asked if they were at the protests when they test positive? What impact do you believe the protest has had on cases?
So I don't think that it's a coincidence, as I was saying before, this worked like a clock, that the marks for the 2 weeks was after Memorial Day weekend and right after the bars and other establishments of that nature were open. And the idea is that if we don't ask specifically to individuals, have you been at the protest? Because there is some elements of freedom and rights for those individuals to be at those protests. And also the information that we collect is voluntarily offered to us. So, but in these dynamics, and I have interviewed some of the people myself on the phone, what we have found is younger individuals who went out in a group, they later learned that someone else in that group was positive, and then everyone else in the group acquired the disease. People at dinner, people at parties, in congregations, kind of settings.
This next question comes from Melissa Thomas with Florida National News. Dr. Pino, will another lockdown be necessary to get a handle on the recent spike in COVID-19 cases?
Yeah, that's an interesting question. I know some people are advocating for another lockdown. The reality is that we cannot lock down and open up every 2 weeks, every 3 months. It will ruin us. The virus is going to be here until we have a cure or a vaccine. And what we have to do really is to learn how to live with it, how to protect ourselves, and how to protect those who are most vulnerable. Closing or opening is a policy decision that I don't get too involved in it. But if my advice is asked, I will offer. But my advice right now in general is we have to learn how to live with this. We cannot go in hiding for the next 6 months until we find a vaccine.
This last one for you, Dr. Pino, is from Matthew Petty with WMFE. With reports of layoffs at Orlando Health, are you worried about hospitals' ability to staff a possible surge in Orange County?
Well, the hospitals have the ability to foresee the need for surge that they may have. So we have full confidence that the hospital know how to handle their business. We are monitoring their use. And as of this morning, we have over 400 beds available in our county, and that is with elective procedures, so there's plenty in the inventory. We also have over 60 beds available in ICU for adults. So the system continues to be healthy on that regard. But those decisions are those decisions.
Thank you, Dr. Pino.
Thank you.
The last few are for Mayor Demings. This question comes from Bob Hazen with West 2 News. Mayor Demings, with the hours-long lines we've seen, especially at the Orange County Convention Center, do you feel that there are enough tests available for anyone who wants one here and now? And should another no-appointment site be open to alleviate the strain at the regional site?
One of the things that Governor DeSantis said yesterday was that from a state perspective, they will be increasing the availability of testing sites. Certainly here with the Orange County Convention Center site, they've added some staff to be able to handle the additional testing demands here within the region. So I believe that we're in pretty good shape there. If you think back to several months ago now, the convention center started with, I think, about 250 tests a day, and then it went up to 500. Now they're offering 2,000 tests potentially each day. So they've increased capacity over time, and that is in a direct response to the demand that we're seeing from residents who want to be tested. In addition, we have increased testing through Orange County Health Services, and our Florida Department of Health has kind of made some adjustments and testing and focusing on the contact tracing so that we can respond appropriately to where there may be outbreaks. You've heard Dr. Pino talk about testing within long-term care facilities or assisted living facilities. And so there's been testing that has been done in that vulnerable population that we've increased. So we're going to continue to do that, to look around the county itself to add testing based upon the availability of test kits. And right now the state is supplying ample supplies for us to be able to meet the current demand.
This next question comes from Ryan Lynch with the Orlando Business Journal. In regards to the CARES Act funding for businesses, how quickly do you expect that to run out with the expanded criteria?
We started out immediately after announcing the expanded criteria with a surge of new applicants based upon the update that I received today. That has tapered off. So we will hold for now to process those applications that we're receiving. If we see where we still have additional capacity with available funding, we may expand the criteria even more. So it's been slightly less than a week now since we expanded the criteria. So we make decisions and then we hold it for about a week. We evaluate and then make appropriate decisions related to our actual experience. So we may expand it further. It's unknown at this point. So within the next few days, we'll make some decisions about that.
This next question is from Joseph Rivera from Laguilla News. He asks, where can citizens get N95 or other masks in the county?
We have continued to distribute PPE within the county. If there is a specific need, then what we would say is go to our website at the ocfl.net/PPE, and there's information there about how you can obtain the PPE. And if through some of our existing programs and planned distributions, we don't meet your particular need, we may be able to do that on a case-by-case basis.
This question comes from Adriana Rosal from Univision, and she would like it translated in Spanish. Her question is to you, Mayor Demings, of course. This Wednesday, the executive order prohibiting evictions ends. Do you have any plans to help families who may be evicted?
Okay, Orange County, again, was one of the very first, if not the first county in Florida to provide crisis assistance to assist with rent payments, mortgage payments, utility bill payments, medical bill payments. That funding is still available, and we're still providing those services. In addition, we will be contracting with various social service agencies that will, that's right, she has to interpret this in Spanish, so, okay. Are you with me so far, Ilya?
El condado de Orange fue uno de los primeros en establecer un programa de asistencia en tiempos de crisis para ayudar a los residentes con el pago de renta, hipoteca, utilidades, biles médicos.
All right. In addition, we will be contracting with social service agencies, the Homeless Service Network, the Coalition for the Homeless, and other social service providers to meet additional crisis assistance needs for housing and food and retraining.
En adición, contrataremos con varias organizaciones de asistencia social para proporcionar servicios de asistencia en crisis como bancos de comida, adiestramiento de empleo, entre otros.
I just have a couple more, I promise. This is from Ryan Gillespie at the Orlando Sentinel for you, Mayor Demings, and you, Dr. Pino. With the rises in cases linked to Memorial Day weekend, what do you expect, or do you expect a similar spike after the 4th of July weekend?
I'm going to remain optimistic because of the different measures that have been put in place, the fact that the governor made the decision to essentially close on-premise consumption at bars, the other sanitary measures that have been put in place by the businesses that do remain open, and the abundance of additional communication with the public regarding the need to mask up and adhere to the guidelines, I believe is working. And so I believe that that will result in the kind of outcomes that we are looking for. A reduction in the numbers from the Memorial Day period of time forward.
All right. Dr. Pino, there are just a couple late ones text in for you. This is Ryan Gillespie here. Do you have a read on when we will peak from this most recent spike?
No, I wish.
This next one comes from Jennifer Marcial with El Sentinel and Ingrid Cotto. Dr. Raul Pino, can you explain in Spanish to the public how the data is collected for the cases reported daily? Many people have concerns as to how we can report on numbers increasing from one day to the other when testing results sometimes takes some time. Also, many have asked, why is the state and the county not reporting on the amount of people that have recovered from COVID-19 in comparison to just the hearing about the positive cases? En español.
En Spanish. So, la pregunta fue, ¿por qué el condado no reporta el número de personas que están recuperándose? Nosotros reportamos el % de personas que se han recuperado. No reportamos el número exacto, porque el número es en realidad muy inexacto. Incluso ese 66% es un número inexacto. Estamos asumiendo que está en el rango en estos momentos del 45%, yo creo, el recovery rate. Con respecto a la otra pregunta, ¿cuál fue la otra pregunta? ¿La primera? The other question?
She asked,
the first part?
The first part, why is the state and the county not reporting on the amount of people that have recovered from COVID-19? And the first part was, many people have concerns as to how
The numbers are reported.
report on numbers.
So, nosotros reportamos los números que nos llegan ese día. No quiere decir que la prueba fue hecha ese día o que fue hecha hace 4 días, pero nosotros reportamos en los resultados que recibimos diariamente. Eso tiene que ver, los laboratorios mandan esa información electrónicamente. Entonces no hay ninguna situación. Yo entiendo que la gente tenga preocupación de si los resultados están demorando 5 días, ¿cómo tú puedes dar resultados? Estoy dando los resultados de las pruebas que recibimos hoy, no de las pruebas que se hicieron hoy. Y esa es la diferencia. So the question was, why with the data, with the results of lab results being sometimes 5 days out when you get a test, how are you able to report the daily data? What we report is always the number of cases that we received that day. It doesn't mean that the test was done that day. We receive that information electronically from many of the labs that are, by law, mandated to report that data to the state.
Thank you. And last one, Dr. Pino. This is from Scott Powers. He goes, what exactly are people who are testing positive being advised to do?
Oh, so we have increased the number of people that are working with us, and we may have to change the priorities on trace investigation as the numbers continue to increase, because at some point it is like drinking out of the hose, like a fire hose. You just can't handle those numbers, and we may have to start prioritizing where to engage in that type of research. But with that, everyone, that is to say that everyone who gets a result, we are trying to call everyone the same day that we are having the results delivered to us. And the advice to those individuals is stay home, isolate, and any close contact that you had should be tested. So that's the first advice that we are giving to everyone with regard to what to do when we receive the diagnosis.
Thank you. That's all I have.
Okay, I believe that if that's all of the questions, we'll conclude this portion of the press conference to the Spanish-speaking media. We are joined today by Commissioner Gomez Cordero, and we'll make her available for one-on-ones as well if she has any messages that she wants to share with the public. So thank you all for being here.